And next we're going to focus on employment practices liability. Physician employment is increasing in this industry sector as opposed to a status which had been the norm for the past 2 decades where many physicians were members of staff. They weren't employees of the organization per se, but now because of a flagging economy, because of myriad reasons, many physicians report that they want the security of a defined employment arrangement, benefits, et cetera, a little bit more stability in their hours, in their lifestyle. That is causing a shift to actual more employee status for many physicians, which are highly paid individuals. The average first-year physician practice salary is around $176,000, and that's pretty significant when you think of all the types of claims that employment claims can include, which are discrimination, harassment, et cetera. All of these claims involve a component, potentially, especially if someone loses their job or is fired, of back pay and front pay, which is a direct impact in terms of exposure to the organization on the salary the individual earns. So when you have these higher paid employees, when they're bringing claims as a plaintiff against the organization, it's a significant expense to settle these claims because the dollars at issue are so much greater from a salary perspective and therefore an economic loss perspective than the average employee at other commercial industry spaces. Trends for EPL, employment lawsuits are on the rise. 2011, there was some legislation that was enacted, GINA, Genetic Information Disclosure Act. 2009, the Americans with Disability Act was expanded. Whistleblower protections were provided, which means claims can be brought and insurance policies need to respond under the Health Reform Law, American Recovery and Reinvestment Act, also the Patient Protection Affordable Care Act, Dodd-Frank in the financial sector. All of these laws were expanded to give whistleblowers, that is employees, the ability to bring claims, and that's causing greater exposure in the area, in the healthcare space specifically, though. Environmental factors, employment rates remain high. Oops, let's just go back for 1 second, please. And time out of work is longer than expected. So employees are hanging in longer, if you will, with employment lawsuits. They're not resolving as quickly, and that's a large part directly proportional to the status of the economy, which generally means that you just have more employees out there who are incentivized to sue by lawyers that don't have as much work as they used to have, and so they're looking for new and different ways and avenues to bring claims, and unfortunately finding a lot of traction in some states as a